Assalamu alaikum. मेरा नाम डॉक्टर आमना फारूक चंजवा है. I'm a resident in cardiology at Liaquat National Hospital, Karachi. I welcome you all to Tonight with Lipid Legends. Hyperlipidemia यानी खून में लिपिड्स की मिकदार का ज़्यादा होना एक रिस्क फैक्टर है बहुत सी मेटाबॉलिक डिजीज़ के लिए. इसके अलावा इट पोजेस एज एन इंडिपेंडेंट रिस्क फैक्टर फॉर कार्डियोवास्कुलर डिजीज़ एज वेल. इस बात को डिस्कस करने के लिए आज हमारे साथ मौजूद हैं प्रोफेसर डॉक्टर ज़ैनब समद साहिबा. शी इज़ अ प्रोफेसर ऑफ मेडिसिन एंड चेयरपर्सन ऑफ डिपार्टमेंट ऑफ मेडिसिन एट खान यूनिवर्सिटी हॉस्पिटल. शी इज़ ऑल्सो अ कंसल्टेंट कार्डियोलॉजिस्ट. मैम, थैंक यू वेरी मच फॉर जॉइनिंग अस टुडे.
थैंक यू.
मैम, एक कॉमन मिथ है कि लिपिड्स की स्क्रीनिंग ओबीस लोगों को ही करवानी चाहिए या ओवरवेट लोगों को करानी चाहिए. कैन यू शेड सम लाइट ऑन दिस फैक्ट?
Thank you, Dr. Janju. I think cardiovascular disease is the leading cause of death in Pakistan right now. So I'm glad that you guys have a very timely initiative in terms of increasing awareness around this issue. And hyperlipidemia is actually one of the most foremost and important modifiable risk factors for cardiovascular disease. So in terms of screening, actually, Pakistan की separate guidelines तो नहीं है. We follow what's done in the United States. And the recommended age groups is not based on obesity, it's actually on age. So 35 and above for men and 45 and above for women. But if you actually have risk factors for coronary heart disease, then it's a younger age cutoff. So 20 to 35 भी with risk factor screening हो सकती है. And in families where there is premature coronary artery disease or history of familial hypercholesterolemia, उनमें बच्चों में भी स्क्रीनिंग की recommendations हैं. So I think that's something we really need to be thinking about at a population level. We have polygenic risks in Pakistan. We have a lot of consanguinity in Pakistan. And most of this is genetically determined, specifically hyperlipidemia. So I think screening is important and the first step in terms of getting treated and then delaying the risk for cardiovascular events.
All right, ma'am, एक general concept है that young females have, because of the estrogen, they have a cardioprotective mechanism. So how true does that hold in terms of preventive measures, and how should we go about in terms of screening?
Again, I think I would boil it down to that the standard recommended age is 45 and above for women. But again, if they have cardiovascular risk factors, that the screening should occur earlier. And women tend to have not only just the standard risks, but we know now from literature and science, many scientific studies, that they have sex-specific risk factors for cardiovascular disease. And these include stuff like early menarche, late menarche, pregnancy-related conditions like hypertension, gestational diabetes, preterm birth. IUGR is also considered a sex-specific cardiovascular risk for the mother. And early menopause also is considered a sex-specific risk. So any of these present in a woman should also trigger concern for cardiovascular disease, for future risk. And lipid screening, so that you have something to intervene on.
All right, ma'am, as a community, what measures should we focus on to decrease the incidence of high lipid levels in the population?
I think that's a loaded question. I think there are 2 or 3 things that can be done. First of all, look, and I'll take this question more from a broad cardiovascular disease risk reduction perspective. Look, there are multiple inputs into the risk. Hyperlipidemia is a big one, also modified by our diet, but also the genetic background risk, right? The genetic background risk changing will take a lot of different kinds of messaging and population level intervention, but the other modifiable risks that can be handled include physical activity, modifying diet, and cutting down on other risk factors that can act in synergy to produce a higher risk for cardiovascular disease down the line. For example, smoking. It will potentiate the issue. if there is a predisposition to metabolic syndrome, then really addressing that, controlling blood pressure, salt reduction, sugar reduction in the diet. So these are really important things that need to be considered.
Okay. When we tell somebody to get themselves screened, what parameters should they go get checked?
So in a standard lipid profile, you should get a total cholesterol, an LDL, an HDL, and a VLDL, as well as triglycerides. So that's kind of standard profile that should be checked. If they can't afford all of those, at the very least, I think an LDL should be checked.
And how often should they do it?
So it depends actually. If your levels are good and you're not making an intervention. If you're making an intervention, then you want to see how well the drugs worked. So you want to then check it every 3 months, and then once you've gotten the patient stabilized with no side effects, then you can check it on a yearly basis.
Just last one question. Can you tell us the validity of getting fasting lipid profile done? Does it hold true, or can we get a random lipid profile done as well?
Yeah, I think that's a good question. I think here people are more comfortable with getting the fasting lipid profile. You can get a calculated LDL with a random sample, but a fasting lipid profile is something that is recommended in general.
Thank you so much, Dr. Salman. That will be all. I hope इस डॉक्टर साहिबा की स्क्रीनिंग की जो हदायत हैं उन सब से आप लोगों ने कुछ गेन किया होगा. आप अपने घर वालों का ख्याल रखें, अपने रिस्क फैक्टर्स को आइडेंटिफाई करें, और अगर आप आइडेंटिफाई कर पाएँ तो रेगुलर स्क्रीन करवाएं. थैंक यू वेरी मच.